Welcome back again. Today we shall look at how One Health concept can be applied in control of zoonotic diseases, specifically rabies. But first, let us understand what rabies is. Rabies is a viral disease that affects the central nervous system of mammals, including humans. It is caused by the rabies virus, which is primarily transmitted through the saliva of infected animals, usually through a bite or scratch. Once the virus enters the body, it travels along nerves to the brain, where it causes inflammation and ultimately leads to severe neurological symptoms and, if untreated, death. Rabies typically transmitted through the saliva of infected animals, most commonly through bites. However, it can also be transmitted if infected saliva comes into contact with mucous membranes or open wounds. The virus can infect a wide range of mammals, including dogs, cats, bats, raccoons, and foxes. The incubation period for rabies can vary from weeks to months, during which there may be no noticeable symptoms. Once symptoms appear, they progress rapidly and eventually death. Diagnosis of rabies in humans is based on clinical symptoms, history of exposure to a rabid animal, and laboratory tests, including testing of saliva, serum, cerebrospinal fluid, or tissue samples from the brain after death. Rabies is almost always fatal once symptoms appear, making prevention critical. Post-exposure prophylaxis is recommended for individuals who have been bitten by an animal suspected of having rabies. Post-exposure prophylaxis involves a series of rabies vaccinations administered soon after exposure, along with rabies immunoglobulin in some cases. Vaccination of domestic animals, such as dogs and cats, is an effective way to prevent rabies transmission to humans. Other preventive measures include avoiding contact with wild or stray animals, seeking medical attention promptly after animal bites or scratches, and practicing rabies awareness and education. Rabies is a significant public health concern globally, especially in regions where the virus is endemic and access to health care and rabies vaccines may be limited. Efforts to control rabies typically involve vaccination campaigns for domestic animals, surveillance of wildlife populations, and public education about the risks of rabies and the importance of seeking medical care after animal bites. Let us now look into a case study of how we can apply One Health in control and prevention of rabies in Africa. In the vast expanse of Africa, where humans, animals, and the environment intertwine, a profound concept guides our journey: One Health. This holistic approach recognizes the interconnectedness of all living beings and underscores the vital importance of unity in safeguarding our shared well-being. At its core, One Health reminds us that the health of humans, animals, and the environment are inextricably linked. When one component suffers, so too do the others. It is this fundamental truth that propels us forward in our quest to combat one of the deadliest threats known to both man and beast: rabies. Enter a vibrant village in Kenya, nestled amidst the African wilderness, where the principles of One Health resonate deeply within the fabric of daily life. Here, humans and animals coexist harmoniously, bound by a shared sense of interconnectedness and mutual respect. Meet Adama, a spirited young girl whose bond with her faithful dog, Simba, epitomizes the essence of One Health. Together, they embark on a journey that will test their courage, resilience, and unwavering belief in the power of unity. As the threat of rabies looms large, a team of dedicated health workers and veterinarians descends upon the village, armed with vaccines and expertise. Their mission: to protect both humans and animals from the deadly scourge of rabies through a concerted effort grounded in the principles of One Health. Inspired by the spirit of unity that permeates their village, Adama and her neighbors join forces with the health workers, rallying their community to take proactive measures against rabies. Together, they educate their fellow villagers, including children and women, about the importance of vaccinating their animals and seeking medical attention in the event of a bite. Through courage, compassion, and collaboration, Adama and her village emerged triumphant in their battle against rabies. Their story serves as a powerful testament to the transformative potential of One Health, reminding us that when we unite in purpose and principle, there is no challenge too great to overcome. As the sun sets on another day in Africa, Adama and Simba stand as symbols of hope and resilience, their journey a testament to the enduring power of One Health in protecting the health and well-being of all living beings. Was this informative? I guess it was. Kindly like, subscribe, and share this information and help me raise awareness on rabies control and prevention.